Hello, and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan, and I'm an associate marriage and family therapist from Southern California. I currently work in a private practice where we focus on child anxiety reduction, and I also do some work for a nonprofit cancer support organization. Today, I will be talking about psycho-oncology. Psycho-oncology is a mental health specialization that addresses the psychological, social, behavioral, relational, and emotional aspects of cancer. Whether you are a loved one of a person diagnosed with cancer or the person diagnosed, cancer has a huge impact on all facets of life. The purpose of this episode is to help mental health and medical professionals recognize and learn to treat the emotional toll of cancer, and for those impacted by cancer to know that you are not alone. The more we talk about the emotional weight of cancer, the more people will receive the mental health treatment that they need. I believe that anyone going through physical illness, especially a life-altering, unexpected disease, deserves mental health care. If you know me, you know that this is an area that I am hugely passionate about and have been working with in private practice and through cancer support community for many years. I plan to continue to work with those impacted by cancer throughout my career. So you may be wondering, Jordan, that seems like an interesting thing to be passionate about. How did you get there? As I described in a previous episode, I have always had an interest in how the brain works and also an interest in biology. I actually thought that I wanted to do something with biology and maybe in the medical field for all of one semester of college until, of course, I failed chemistry and when I found psychology. Cancer and chronic illness has impacted my life in many ways, and so finding this niche just fit. I have a family history of cancer, and for as long as I have been alive and longer, my amazing mother has participated in the Susan G. Komen 3-day walks. The 3-day is a 60-mile experience full of pink, laughs, tears, dogs, watermelon boobs, and so much more, all for the purpose of bringing awareness and fundraise for breast cancer research. When I was 16, I completed my first 3-day walk with my mom, and I have never looked back. The 3-day is a weekend I look forward to every year and one of the most incredible, meaningful experiences of my life. In addition to being an incredible experience, the 3-day also ignited my passion for helping those who are impacted by cancer. Through my participation with Susan G. Komen and work at Cancer Support Community, I have seen an immense need for mental health treatment in the face of physical illness. I do not only mean with cancer, but with any physical difficulty, illness, or ailment that a person goes through. Physical challenges impact our minds, and that is why I'm a huge advocate that mental health and physical health should always go hand in hand. Whenever I tell someone about my work with people impacted by cancer, I usually get the response of, wow, that is so sad, or how awful. But no, work with cancer does not always have to be sad and awful. I used to be so scared of the word cancer and, of course, working with people who have experienced cancer, but I'm less scared now because of all my experiences. This work is meaningful and rewarding and fascinating and nuanced and hopeful. Cancer is so much more than a sad, scary word. As you can probably tell, I can talk about this topic for hours, but I will not. I will try to keep it succinct. So, why is psycho-oncology so important? Physical health is not just physical. Cancer affects every possible aspect of your being. Cancer splits your life into a pre-cancer and a post-cancer existence. Your future is uncertain, the next few days are uncertain, and you are forced to confront your mortality. Treatment decisions are incredibly difficult, and the emotional toll may never fully hit when you're going through treatment. Post-treatment could be when the emotional weight of what you just went through comes, even though doctors and other medical professionals tell you that you can just go back to normal life. You cannot. For people who are going through long-term treatment or dealing with end of life, the mental toll may be even more dramatic. And there is a huge mental toll as well on your caregivers, your loved ones, your friends, and everyone who is impacted by this disease. This is why mental health care at diagnosis, during treatment, post-treatment, and in anticipation of end of life is crucial. A diagnosis of cancer completely uproots your life and changes your present and future. Quite often, people who are diagnosed with cancer immediately go into survival mode. You have this life-altering news, and now your mind goes to, all right, how do we begin to fix this? You start the long journey of treatment, which can include chemotherapy, radiation, surgery, and other procedures. Oftentimes, people do not deal with the emotional toll of cancer until treatment is done because you have no time to process what you are going through. When you are diagnosed, one of the hardest parts is to think about how to tell your loved ones. Especially when there's kids involved, this part is tricky. I have included a resource of a talk that I gave at Cancer Support Community called What Do I Tell the Kids?, which details what you may guess of how to tell your kids. Some tips for right now are that it is important to be clear and concise while talking to kids. Don't elaborate as that gets confusing. Once you know what your treatment is going to look like, use the specific treatment words such as chemo and radiation. Also, let your kids know what treatment will be like and how it may affect your body. For example, you can say, on chemo days, mom may be feeling really tired and mom may lose her hair. Let's talk about that. In the resource linked below, I give more detail on how to speak to kids based on their developmental stage. It is okay to say, I don't know, with kids. If they ask a question and you don't know the answer, that is completely fine. You can say, I don't know, but I have a lot of support around me. You have a lot of support, and doctors are trying to help me as much as they can. It is super important with kids to make sure to emphasize support systems. They might have a new schedule and routines, such as who will pick them up from school, but ensure that they will always be loved, supported, and cared for throughout the experience. Again, you can find more information by clicking the YouTube link in the episode details. Letting your partner, friends, and other loved ones know about your diagnosis can be very challenging. Some people may not respond how you expect them to. Don't be afraid to ask for help and let your loved ones know what you need from them. So now for during treatment. You are chugging along, going through treatment, and taking it one step and one day at a time. Treatment is really terrifying. There are so many questions of how long treatment will last, if it will work, how it will affect you, and much more. It is so important to advocate for yourself. You know your body best, and if you do not feel that you are getting adequate care, if you feel that something is wrong, if you have any questions at all, say something. Doctors are the medical professionals. However, you are the authority over your own body. When you have cancer, you're a patient, but you're also an advocate. So don't be afraid to ask questions and push for what you need and deserve. When making difficult treatment decisions, it is natural to look towards family, friends, and doctors for guidance, but the main decision comes from you and your gut. When talking to doctors about treatment decisions, an important question that some of my clients have asked their doctor is, if I was your loved one, what would you want me to do? Or what would you choose for me? These clients who have asked these questions to your doctor feel that the doctor gives an authentic response and a very clear-cut response, which helps these clients make their decision. Cancer can exacerbate existing mental health difficulties and spark new ones. Cancer impacts your body, your relationships, your loved ones, your identity, and so much more. I want to first talk about an identity shift. It is very common that people experiencing cancer do not feel like themselves. You have physical changes such as hair loss, skin and weight changes. There may be a change in cognitive function with chemo brain. There also may be a feeling of disconnect with your identity of being a man or a woman. This particularly happens with genital-specific cancers such as breast cancer, ovarian cancer, and prostate cancer, to name a few. For non-binary and transgender people, cancers that affect genitalia take on a new meaning and complexity that cisgender people may not experience. Cancer adds a new layer to navigating relationships and especially family dynamics. In your household, there may be role reversals and role shifts with members in the family. For example, partners or spouses may shift into the caregiver role, or kids may take on more responsibility in the house. This is completely normal, but it is also very challenging to navigate, and someone like a therapist or a counselor or a support group can help with that. Your socialization needs may also change, which can impact friend relationships. There may be some anxiety with seeing others and having to tell them the news of diagnosis, or with your new body or new look. And it's also difficult to have to fend off questions of what you're going through. This is also incredibly difficult to navigate. You may be surprised with how people react to your cancer diagnosis and treatment. People react in such a strange way to cancer. Some people smother, some people disengage, and it really can be surprising. As I said previously, it is so important to advocate for your needs, especially with friends and loved ones. You sometimes have to tell people what you need and how you want them to respond. An example that came up in a support group that I lead recently is that the question of how are you is such a loaded question. When you are going through something like cancer, when people ask, how are you? It is hard to know how to respond, and that is completely okay. It is okay to let your friends and loved ones know, hey, it's really hard for me to answer a question like that, but feel free to ask me something more specific about what I'm going through. Or you could even tell your friends and family that please do not ask me any questions at all. I will bring it up to you when I need something or when I want to tell you something. Either or anything in between is completely okay. It is just what makes you comfortable and supported during this time. Grief is huge while going through the cancer journey, and that does not mean grief as in bereavement, but it means grief as in grieving the life that you once knew and grieving the expectations that you had for the next week, the next month, the next year for your life. Cancer adds a lot of loss into life, and that is very, very hard to deal with on your own. This, of course, can lead to depression and anxiety. A word that is prominent in the cancer world and in the physical illness world is scanxiety. So that is anxiety about scans or about treatment. Scanxiety is very present during treatment and also after treatment. Scanxiety can last even when you're in remission because following treatment, there are appointments monthly or every 3 months or every 6 months. So scanxiety is very, very present. And that looks like getting anxious or nervous before a scan. I will talk more about managing anxiety in a bit. Next is uncertainty and feeling out of control. Cancer is pretty much the epitome of feeling out of control. You are not in control of your body. You're not in control of the treatment. You do have little things throughout the journey that you do have control over, and those are so important to focus on. There is so much uncertainty in what the future holds and just how this cancer will progress, how treatment will look, and how you will be affected by it all. The feeling of uncertainty and feeling out of control is ever present, even post-treatment. Doctors, friends, and family expect you to go back to normal life, but that is truly impossible. You have just finished treatment and everything that your body and your mind went through, and you're now left with the now what feeling. The emotional toll of what you just went through hits. A lot of people who have gone through cancer and are considered survivors feel abnormal or feel that they are crazy for feeling the emotional weight of cancer post-treatment, while everyone around you is telling you that you should be fine and going back to normal life. People think, well, then why can't I do that? Why am I feeling all of these emotions now? This is not abnormal at all, and this is actually quite typical. So know that you are not alone in that. There is also the fear of reoccurrence that is incredibly triggering and can come up often, and this can, of course, intensify anxiety and depression. Oftentimes, being in long-term treatment means that the cancer is metastatic. Metastatic cancer is a stage 4 diagnosis and means that the cancer has spread from its place of origin. So, important note is that this does not necessarily mean that the cancer is actively spreading, but it can mean that there's actually no evidence of disease and you have to continue long-term treatments in order to keep it that way. There is also a high rate of recurrence with metastatic disease. This in itself comes with so many varying emotions and overwhelming uncertainty. End of life, of course, brings up so many emotions such as anxiety, depression, and anticipatory grief. With end of life and long-term care, some get help from home health nurses, palliative care, or hospice care teams. An important note is that palliative care does not necessarily mean end of life. Palliative care just means that a team comes and helps someone who has a serious illness regularly. It is a great choice to have regular support for the person with cancer, and it's good support for the individual's loved ones. Hospice care, on the other hand, is more for end of life, and it is to help the individual with a serious illness be more comfortable while they are declining. Hospice care is meant for those who are not undergoing more treatment for their illness. So that is an important distinction, that in palliative care, the person could still be going through some form of treatment. Hospice care also does not necessarily mean that the person with illness will decline immediately. For example, I know a caregiver whose loved one has been in hospice care for almost 2 years now. So as you can see, in all stages of physical illness, there is need for mental health care. Mental health treatment throughout the cancer journey can include various therapy modalities such as cognitive behavioral therapy for negative thinking, grief therapy, mindfulness to lower stress and anxiety levels, acceptance and commitment therapy for radical acceptance of the present situation, existentialism to confront mortality and meaning of life, and so many more modalities and theoretical orientations used. You do not have to have a pre-existing mental health concern in order to get therapeutic support during the cancer experience. From everything that I just talked about, you can tell that cancer is a transformative experience, and it is so helpful and necessary to get mental health support during this journey. Something that I have found really fascinating is that it seems that some therapists are scared of treating people who are affected by cancer. Of course, it is crucial to not treat someone whose presenting issue is out of your scope of competency or care, but treating people who are impacted by cancer is really not scary. These clients present with big life changes, emotions, anxiety, depression, same as every client. There are some great webinars, workshops, and programs out there that help mental health professionals strengthen skills of dealing with cancer and grief. I definitely recommend to research those. To all mental health professionals, do not shy away from working with individuals impacted by cancer or other serious illness. We need more practitioners who are proficient in the field of psycho-oncology. In addition to an individual counselor, people with cancer and caregivers can find support from hospitals, nonprofit organizations, clinics, and treatment centers. I will definitely be releasing an episode at some point that gives tips and tricks to mental health professionals on how to treat a client or family affected by cancer. My episode for next week will be geared towards those who have just graduated from a graduate level therapy program and are starting the next step of postgrad and associate life. I hope you found this information about psycho-oncology useful and eye-opening. Thank you for listening to Just Therapist Things, and I will talk to you soon.